He's finished his residency from Arvind Hospital, Madurai, and now he's pursuing his retina fellowship in Arvind Hospital, Coimbatore. And he runs a YouTube channel which is very famous among the students, and he's going to give a talk on animations and how to create this animation using simple routine devices what we have.
Thank you so much for being here. The very first IC of the very first day. It's always a great pleasure to be here. And I wholeheartedly thank the audience for being here. So, Dr. Venkatesh Prajanna is my mentor, is my guru. He's someone who I really love, I take a lot of inspiration from. And now I add Dr. Prasanna Venkatesh also to the list. A huge fan. So after the 4D, 5D, and 6 dimensions, I'm going to talk about only one dimension. I'm going to take everything to old school. So after an overwhelming technological blast, it's going to be completely Zen. So before the end of this talk, you will all learn a technique, a hack, which can make your next presentation much better. With that, the keynote presenter, how to modify slide presentation for no more virtual. Thank God, we have stopped being virtual, going offline for the ophthalmic webinars. I'm Dr. Pranesh, and I want to bring in 4 questions before we move further. This is the order of significance. Before even we start to present, it is important to ask ourselves, are we answering these 4 questions? Why, who, how, and what? You see, I've cut off that what. Content never matters when it comes to presentation. It's first and foremost is we should understand why, the purpose, why are we presenting in the first place. Then comes who our audience is. Catering to the needs of the audience is going to be the ultimate way to go about. And this talk will focus on the how or the techniques to make the presentation much better. I'm going to share a few rules. Rule number 1, please plan on a piece of paper. I know after the technological blast and the title being keynote presenter, this guy is asking you to go back and take your papers out. But nothing works better than planning our talk on a piece of paper. How many of us open up the slides immediately and start preparing for presentation? In experience with that? Great. So we're all in the same shape. We do that. It's very tempting to open up the PowerPoint, adding slides, copy paste from a PDF or somewhere, or even we can even get or borrow PowerPoints from others from SlideShare. We start modifying that. But nothing works better than planning on a piece of paper. This is the rough work I did for the talk, which I'm giving currently right now. So after this rough draft, I made a proper classification of topics, how to go about, how should I structure my talk for this. If you are a techie, you can use Mind Map, which is a brilliant software. Plenty of them are available for free. And you can use this mind map not just to teach, but also to learn OPHTHAL in a better way. Xmind is a brilliant software. There are multiple others as well. And you can even use that particular software to present. And that brings me to rule number 2, classify the content. Like how we divide and conquer the cataractous lens, let us all classify the topics one by one in a piecemeal approach. Divide the big cake and feed the audience one piece at a time. So what I'm saying is all common sense, but most of the times the common is going to be more uncommon. This is the presentation material which I made for my residents on ocular TB. So on a piece of paper, I write everything, I add images, classify the content, and I present from the very same document. I hardly use PowerPoints to teach my residents. So I use this app called Notability. If there is one investment which all ophthalmologists should make is get an iPad. And if there is one app which all of us should buy, it's going to be Notability. Okay? It's paid. If you want a free, there are multiple options as well. We have OneNote by Microsoft, again, catering to the needs. Why? Because Notability gives us so much flexibility, so much simplicity, what a PowerPoint failed to deliver. I know I'm being hypocritical. I'm talking about keynote presentation. I'm talking about the use of Notability. But the reason why I'm saying this brings me to rule number 3. please avoid PowerPoint poisoning. How many times have we seen this kind of slides in every conference? Any experience? Yes, all of us. That is the most important thing. I understand PowerPoint is a brilliant tool which makes our lives a lot more easier, but unfortunately, it's being abused, misused to the core. This slide talks about PowerPoint simplicity, but please have a look at the slide itself. How crowded, how difficult it is for us to read. It's always important for us to understand that slides are never a substitute for the speaker. If the students, if my residents or fellows can read everything from the slides, then my presence is not at all needed. I can very well move out of this hall and we can ask them to read the slides as well. Boring slideshows never help us to learn science properly. So how to go about it? I understand we all use PowerPoints, and what I do is I make use of this presenter notes, something which is very underrated, underused. So this PowerPoint presenter notes is available both on Keynote for Mac as well as for your PowerPoint. And here you can go and you can write your notes. So the presenter will see this slide, whereas the audience will see only this slide. So it makes the slideshow much more interactive. Instead of just reading from the slides, I can show what is here and I can read from here. But unfortunately, you need two screens for this. And since most of us are got used to Zoom, there's an option to select a portion of the screen. What I mean is, go to Advanced, click on the portion of screen on your Zoom. Then what you can do is, you can just select only this part, only the slide part of your entire slideshow. So what the presenter will see is the entire thing, but what the audience will see is only this point. I hope I'm clear here. This is another very useful way. So that what I can do is I can just present, by just looking at the slide, I can just talk to the audience. But the audience will see only this, only my slides, not my text. It's yet another brilliant way to make our presentations sound much better, and you will also appear much more smarter. Enough with the slideshows. Let's talk about emotions. The great man Aristotle gave us the three elements of oratory: ethos, logos, and pathos. Ethos means credibility. Logos means logical argument. As ophthalmologists, as medical scientists, we focus on ethos and logos, but how often are we focusing on the emotions of the audience? That is pathos. I'm going to the old school again. By telling vividly engaging stories to our audience, we can make our presentations much more memorable, and that is going to be the message of this talk as well. Please engage the emotions of the audience by telling stories. And fortunately, our ophthalmology, our medicine has integrated stories through case presentations. So what is the summary of this talk? Please keep it simple. Simplicity sells. It's all about impressing or respecting your audience. Give messages, the take-home pearls. And please remember, PowerPoint kills if it's not being used properly. It's like fire. And always level the lecture. Take lectures one step at a time. Give the students in a piecemeal approach. And last but not the least, it's the emotions which appeal the audience more than anything else. This is my YouTube channel. I think we have been sharing lots of YouTube videos, but there is a playlist where you can access on teaching alone. And I hope the respected seniors and the esteemed audience in this group would find it useful. Thank you so much for the patient listening. Let us all teach to reach.